NMAP. We heal with zeal.
Together we navigate
new frontiers.
Hello friends, I'm Dr. Purvi Kadakia Kutty. I'm consultant pediatric hematology and oncology at Apollo Hospitals, Navi Mumbai. On the occasion of World Anemia Day, I'm going to be talking about some facts and myths of anemia in children. Anemia in children under 5 years of age still continues to be a major public health concern, especially in developing countries like India, where the prevalence is as high as 75%. So what is anemia? Anemia is basically the reduction of red blood cells below the normal value for that age and sex. Red blood cells are produced in our bone marrow. Red blood cells have a special protein, which is the hemoglobin, which carries oxygen to all parts of our body. So when the red blood cells reduce in the body, in turn the oxygen levels to all the parts of the body, including important organs as well as our brain, is reduced, and hence we have the consequences of anemia. Now, anemia in children, why is it such a concern? Majorly it is seen in two vulnerable age groups: the infants, that is after 1 year of age, and in adolescents, that is in growing children. What are the causes of anemia in these two vulnerable age groups? Anemia can result as a result of decreased production of red blood cells, or increased destruction of the red blood cells, or anemia because of blood loss. So decreased production, one of the commonest causes, is when the micronutrients are not enough in our diet, so we cannot make the red blood cells. So which micronutrients are important? Iron, folic acid and B12. So these are the three things we must remember, and food fads which are associated behind these three micronutrients, which causes anemias. So in infants, which is a vulnerable phase, is when they are 1 year of age and they are weaned off the mother's milk. That time the food fads or the food mistakes which we do hampers the iron absorption in their gut. For example, when infants are weaned off mother's milk at 1 year of age, they just need 2 cups, that is about 120 ml each cup of milk. So when these infants are given a predominantly milk-based diet for weaning and not given iron-rich foods, then they start to develop iron deficiency anemia. So we must not give infants a milk-based diet. Second is, these children should receive iron-rich and a good balanced diet, which includes pulses, proteins. There are 2 types of proteins which enhance the iron: heme protein and non-heme proteins. So heme proteins are basically from the animal protein like meat, poultry products, fish, etc. And non-heme proteins are green leafy vegetables, beans, pulses, etc. So we must remember a balance of good heme and non-heme proteins is essential in the diet to prevent iron deficiency anemia. A second vulnerable age group, as I mentioned, which causes deficiency anemias in children, is the adolescent age group, because it is that time when the children are having a growth spurt, they require more, and they are often eating a lot of junk food and food fats associated with that. So we should avoid junk food, again encourage a healthy balanced diet in this age group as their growth needs are more. So this was about decreased production anemia or micronutrient deficiency anemia. Other causes of decreased production anemia is when the bone marrow shuts down. So it's like the factory shuts down, so there is no production of red blood cells. This can happen in a number of congenital syndromes which are associated with bone marrow failure syndrome, and they can also occur iatrogenic, or a condition which is known as acquired aplastic anemia, when the bone marrow shuts down and there is no production of the red blood cells. Another common cause of anemia is hemolytic anemia, or destruction of the formed red blood cells. This can also happen because of congenital conditions as well as acquired conditions. The congenital hemolytic anemias are our thalassemia syndrome, sickle cell anemia, G6PD deficiency, RBC membrane protein defects, and etc. These need to be worked up extensively, and the child should be diagnosed for these conditions to go ahead for the treatment required. Acquired hemolytic anemias are maybe because of drugs, infections and various causes. It is usually temporary, and once the hit is removed, the child will overcome this anemia. Another cause of anemia is a blood loss anemia, in which there may be a massive blood loss either because of a road traffic accident or a chronic GI bleeding in a child, or menstrual loss, which is chronic enough to cause decreased red blood cells, which lead to anemia. Now, as I explained you, what are the consequences of anemia and what are the signs and symptoms we must look for to pick up anemia in a child. As red blood cells carry hemoglobin, which carries oxygen to all parts of the body, so this reduced level of oxygenation to all the muscles, tissues and cells can lead to many manifestations in a child. Something as simple as irritability, fatigability, child is getting very tired, he's listless, he's not interested in his appetite gets reduced. These are the mental symptoms of anemia. Also, organ symptoms when they start showing up, that means the anemia has reached to a significant level. So the child who presents with severe anemia of a chronic onset may have swelling, cardiac compromise, swelling over the body, decreased urine output, breathlessness, and this child requires urgent attention. Anemia not only affects the growth and development of the child, but it also affects the mental and the cognitive functions, and this is more so common, and it should be picked up in preschoolers to avoid a permanent damage. So they may have subtle signs of learning disabilities, decreased mental activity, alertness, coordination. This can be some of the consequences of anemia. Now, how do we diagnose anemia? Anemia is diagnosed by simple bedside blood tests, which is the complete blood count and the reticulocyte count, which can give us a clue to why the anemia is there in the body. Is it decreased production or increased destruction, or whether there is ongoing hemolysis? So, how do we treat anemia? After we have ascertained the diagnosis of anemia and what is the underlying cause, the treatment of anemia is to treat the underlying cause. When there is iron deficiency anemia, we must provide with iron supplements. When there is B12 deficiency, we have to give the children B12. When there is folate deficiency, we have to supplement their diet with folate and add folate supplements. So, is there a need of blood transfusions in all anemia? No. Only when the child comes in a severe CCF or a cardiac compromise and the anemia level is very severe, he will require a blood transfusion to tide over the acute crisis, which may be life-saving. After that, to treat the anemia, we have to treat the underlying cause. To summarize, anemia is a major public health problem in Indian children. We must identify the causes of anemia, target the vulnerable age groups, especially infants and adolescents, say no to food fads, encourage a balanced and a healthy diet. Apart from that, we should pick up symptoms early. Treatment and early interventions will prevent long-term complications in our children. Thank you.